Again, welcome. This is the Nebraska Regional Food Systems Initiative 2025 Food System Speaker Series. We operate this September through May of every year. So we got some good lineup of folks coming down in the next couple of months to kick off this series. So, okay, with that, I'm going to turn it over to Dr. Stephanie Hartman. Stephanie is an assistant professor at UNMC in the Department of Internal Medicine, and she's going to be talking about exploring the relationship between soil health and human health. Stephanie.
Okay. Can you see the right screen?
Looks good.
Perfect. I am gonna go back. This is not my forte on like the technical stuff. Thank you for the invitation. I'm really excited to speak to this group today. I just appreciate starting a conversation around this. So we'll go ahead and get started, and then I'm going to leave room for questions at the end, which may mean that I'm skipping a couple of slides. So just bear with me. I have a lot in here. I don't have any medical financial disclosures. I am also not really speaking for my employer. I do receive income as a landowner in this state, and there's no medical advice in this discussion. Um, these are some of the objectives that we're going to talk about, and we'll just dig right in. I will kind of introduce myself here at the beginning as we go along, just so you kind of have an idea of where I'm coming from. But um, this statement, is several thousand years old here, or a couple thousand years old. And so the connection between food and health has been recognized for a really long time. I think one of the more common or adages that we hear more often now is you are what you eat. And that actually has its origins from the 1800s and was translated from French to English. And the origin of that is really around some malnutrition. Um, and the translation is tell me what you eat, and I will tell you what you are. And I think, the implication overall is that food that we eat has bearing on both our mental and our physical conditions. And so this is I'll just introduce a little bit about what I do. As Ben said, I'm a general internal medicine physician. I've been at the university. This is my 10th year there. And prior to that, I was at the VA as a general internal physician, which means that I take care of people on a regular basis. I actually just finished clinic this morning, spending a lot of time on chronic disease management, um, as well as addressing people's mental health concerns or physical concerns. And to be honest, when I started to pursue this career, I thought I was going to do a lot of prevention. And that is just not how it's always ended up. I do a lot of management of chronic disease, and my upbringing is on a farm. I started my college fund at the age of 6, raising chickens and selling eggs after church, and then I um, raised beef cattle and sheep and garden moms. And so I very much grew up in a farm community in rural Missouri. And in about 2018, started to just have a little bit of burnout around sort of the cycle of trying to help people be healthy through food, and then struggling with what their opportunity was, when they left my clinic around what they were going to eat and have access to. So this journey started around then, and then as most of you are aware, we had a global pandemic, and it put a little bit of a pause on my exploration of that. But I just wanted to spend some time today talking about kind of the intersection of soil health and human health, and how I see maybe moving forward in Nebraska. And I'm just really excited about some of the connections in this group. So um, I think this is a tricky question because honestly, most people know that they don't have health when it goes away, and we don't always recognize what health is, while it's occurring. And So, to give you a definition of soil health, there are lots of entities that kind of weigh in with like a formal definition. And thankfully, none of these are overly extractive sort of definitions to health. I really liked this definition, though, out of this publication, and I will share all my references at the end of this, that healthy soil suppresses pathogens, sustains biological activities, decomposes organic matter, inactivates toxic materials, and recycles nutrients, water, and energy. I just think that's a good summary of what we would aspire to in a healthy soil. Um, so let's kind of think about that along with human health. So this is the World Health Organization's definition of human health, and it came about after the Second World War. And then, ideally, it's a complete physical, mental, and social well-being, and not just the absence of disease. Added to that recently is kind of the idea of environmental well-being. And this is the appropriate interaction between humans and the environment. Um, and if you look at some of the CDC's discussion about this, and I will use some of their information throughout this talk, this isn't really a new concept. I mean, this is an indigenous. I was looking back through, a lot of the presentations that have been done within this forum, and this is indigenous wisdom. We're not centric to our spaces. And so we are in collaboration, not with just each other, but with all of the things that surround us, microbes included. And so the people might recognize this as macro levels where deforestation or like an infectious disease outbreak, such as like salmonella, might impact that environment. Um, but I think that it also can be much more insidious in the, chronic disease states or mental health concerns. And so that's kind of where I'm going to focus for this talk. And then I really want to highlight these two authors at the bottom over the last probably 5 years have contributed to the idea that soil health is, in fact, public health. And so if we use the framework of adding environmental well-being to the definition of human health, this this is really sort of integral that we consider our soil as a part of our public health efforts. Um, so I'm going to move forward sort of with that public health lens on. And I want to introduce you to a topic. Some of you may be familiar with this topic, especially if you saw this presentation or a similar version of it at the Nebraska Sustainable Agriculture Society conference last year. But for some of you, this may not be something you're familiar with, but this is a part of my daily practice as a physician. The social determinants of health are the conditions and environments where we're born, we work, we live, we play, worship, all of those things, and they have an impact on our quality of life and our, health outcome risks. And um, I think, we are assessing these in the clinic setting because if we are not addressing them, we often cannot make a dent in people's disease state or their preventative health or anything like that. The other thing is that, it's recently got the attention, particularly during the COVID-19 pandemic, because we saw such huge disparities across outcomes with different populations, even around food security. So, I also wanted to just share this graphic because I think it really does a good job of representing the interaction and the sort of similarity between on, the left side of this wheel, all the things that we think of around human health predictors, and then on the right side, soil health predictors and how they really do have a lot of things that, are like, I guess. Soil is hopefully a living space. So, um, what I would like to do is explore the next part of this as soil determinants of health, using the little areas in each one of these to talk about how soil relates to each one of these. And we are going to start with just the economic stability and, in particular, food security. And I cannot cover all of the topics underneath of this. So I've picked out a few examples from each one. So, just to cover really quickly what food security is, this means access by all people at all times to enough food for an active and healthy life. And there are, when we talk about food insecurity, it's these two lower levels of low and very low food security where they have, multiple disruptions around eating and increased anxiety about knowing where their next meal would come from. If we look at Nebraska statistics, they are worse than the national average around food security incidents. This is published data, sort of like the average from 2021 to 2023. If you looked at just this 2023 data alone, that rate is actually 13.6%. So it's gotten worse, over time. This means that almost 300,000 people are facing hunger in the state, and over 90,000 of those are children. So food demand requires that we have healthy soil, and so that is how I would argue that we are going to have, challenges if we can't have healthy soil meeting this demand around food security. I'm very aware that food security and food insecurity has lots of components, but I want to put a plug in for healthy soil being part of, the solution to that. So we really need some excellent stewardship around soil in order to um, tackle this problem. Um, and so I'm going to just drill down. A lot of you know way more about this than I do. Um, but this particular web plays a lot, a critical role in food security. The microbiome is an explosive area of investigation for, both the soil and humans. A lot of that research is being done within our own system, which is very exciting. But if you disrupt the human gut or the human skin, you're going to get, potential dysfunction. And an ideal web is going to have helpful bacteria, fungi, protozoa that are kind of actively decomposing, just as we talked about in that definition of health. And we are one of the animals in this food web. And so when you have disruption of gut microbiome, you're also going to potentially have some dysfunction. And I'm just going to highlight a few studies to kind of give you an idea of how diversity in the gut might differ across populations and what that might matter for health. So, this study was conducted using fecal samples obtained from 531 individuals, and they were either from Venezuela, rural Malawi, or inhabitants of U.S. metropolitan areas. I don't have time to cover like the twin studies that were done in this, but that was also an interesting piece of this study. But they were characterizing the diversity of bacterial species that were present. And it's pretty well known that as humans, we start out with like a fairly unpopulated gut that becomes rapidly populated over the first couple years of life. But what was interesting in this study, and can you all see my pointer? Okay, perfect. Um, is that if you look at this, operational taxonomic units, which would be sort of the diversity of gut microbiome, the US population had a much, much less diverse gut population. And this is probably related to not just like the proximity and relationship to um, animals, but also the types of food that are in their diet, as well as their methods of acquiring food. Um, I'll just touch on one other study, and this was kind of a fascinating study done in ethnically Irish, pretty homogeneous group of people, 161 individuals that were over 65 years of age, and they were either in what was considered like community living, or they were in more of a nursing home setting. And they broke them down into a low fat, high fiber, a moderate fat, high fiber, or low fiber kind of groups with the moderate fat and high fat as well. And so I'll show you on this next slide, and I'll just have you look at up here in the top left. This group, the DG1 and the diet group 2, those are the ones that have the high fiber. So this is the group with low fat in the green. The yellow is the group with moderate fat. And then the orange is a low fiber, but it was moderate fat. And then the red is the high fat, low fiber. And you can see that as you decrease the fiber, the diversity, so this is the diversity curve. This is just the number of actual bacteria in their gut also started to decrease. Um, and the other interesting thing out of this study, and I will go on to the next one, is that those people that were in the community, so in this particular thing, this is the same thing, the number of actual gut bacteria, and then this particular one, it's the diversity of that gut bacteria. The people in the community had a more diverse microbiome. And if you took people in the community in this study and then you moved them to sort of a long-term stay, um, setting, and you followed their microbiome, their diet actually changed pretty rapidly. They pretty rapidly went, down to a low fiber type diet, but their microbiome took about a year to do that same change. So, um, just I thought an interesting look about how much it matters, like what we're eating, um, and what your gut bacteria look like. So I'm going to switch to the employment security part and just talk about one particular area. This is a New England Journal article that was published in 2019. And this was a thing that was first noticed in the early 1990s in Central America with sugarcane workers that were presenting with end-stage renal disease, which is pretty much kidney failure, who didn't have classic risk factors. So when we look at classic risk factors for chronic kidney disease, that would be like hypertension, diabetes, or other diseases that affect like the structure of the kidney. Um, and then this has been corroborated in other studies since then in agricultural workers in other parts of the Pacific coast and Central America. And alarmingly, this also has showed up in some of the women and children who are not necessarily farm workers, but are associated with those individuals. Um, this other article is a study in the upper Midwest, so the Dakotas, where they were looking at trying to create basically a predictor. So these younger individuals who don't have some of the classic risk factors, um, they're looking at environmental data to provide impact or insight into the impact of some of the agricultural practices that might be happening, that would predispose or put at risk these individuals. And this could be lots of different exposures. It also could be the kind of combination of potential environmental risk as far as like pesticides or heavy metals in combination with risk for dehydration and those kind of things. But I do think it's really important. Um, for longevity of people who are working in these situations to kind of determine, because the only treatment for end-stage renal disease is essentially dialysis or transplant, which is extremely impactful to the ability for someone to work or, have a long life expectancy. So, under the heading of social determinants of health around education access and quality, I'm just going to highlight Omaha. And I tried to make this talk as Nebraska centric as possible. But Omaha happens to be the it's the site of the largest residential lead site in the US. And it was related to smelting and refining that was done up until 1997. This cleanup began in 1999. As recently within the last 6 months, I've seen a patient in clinic whose child actually tested positive for elevated lead levels, and they happen to live, in this area where you can see the levels, and some of those red dots are higher than 1,200 parts per million. The EPA um, level, I guess, that in residential soil was actually recently lowered from 400 parts per million, which are those like kind of light blue dots, down to 200 parts per million. And in areas where someone might have multiple sources of lead, the EPA is using a screening level of 100 parts per million. So you can see that like this is an unfortunate sort of thing, and that is occurring in the soil in this area. And the reason why this it kind of fits under this early childhood development and education and language and literacy is that the neurologic impacts with lead exposure early in life, especially, but even, in adult patients can cause slower brain growth, affect their behavior and speech development, and cause immune system disruption. So that's kind of how that soil impacts this particular social determinant of health. So um, I'm gonna move on to this category of um, like nutrition security and just talk about, I think I'm missing a slide here, so I apologize. This was not a smooth transition, but um, this is kind of, I guess, where my heart lives. So I know I covered like food insecurity and food security, but I'm optimally we should be aiming for nutrition security. So the idea that everyone has not just consistent access to food, but they have consistent and equitable access to healthy, safe, affordable food that promotes optimal health and well-being. This is just a step up from being food secure. Um, and I think one concern in our state, and this is a really old figure, and part of that is this is somewhat a concept that is change. Maybe you've heard of food deserts. That was really like a term that is moved away from, and I debated on whether I was going to cover that up in a graphic that I didn't make. But ultimately, this is kind of the easiest picture that I could find to access this. It's now a very interactive map, and these areas are characterized on the USDA's website as either low income or low access food areas rather than food deserts. Um, and this is actually measured through kind of four different categories that includes both distance and whether people have access to a vehicle. Um, and so if you have access to transportation or you live in close proximity to healthy food, then you have more likelihood of being nutrition secure and as well as food secure. Um, so kind of moving towards nutrient density as a relationship to both nutrition security and what that looks like when we talk about soil health. And obviously, soil is what's in the soil is going to play a huge role and sort of set the stage for what nutrients are in foods. And therefore, what your soil looks like with regard to organic matter and microbes and the available nutrients or, potentially any sort of toxins is going to impact what that, health looks like as far as what ends up being the food that you're able to eat. I am not like the expert on this, but it is an area that I'm very interested in. And I do think I'm just going to point out a few um, things from the study. And I think it's an area that definitely needs um, more look, and it's kind of multifactorial because we know that in cases where plants are under stress for some reason, they may actually produce more phytochemicals or phytonutrients, which could be beneficial to people. But finding like the right balance for that is also important. Um, so in this particular study, they were looking at regenerative practices over 5 to 10 years at 10 locations, and they were paired farm trials where the comparison was conventional. And in this particular um, it's actually a pretty small sample size, and so they don't actually have like a statistical significance between the soil organic matter, and then they also looked at the Haney test scores for these regenerative produce. I'm going to show you this next thing, not to like overwhelm you with a whole bunch of data, but I'll just point out that basically what they did was take an average ratio of the concentrations um, across all the crops that they looked at, knowing that they had pretty small sample size across, just 10 farms. So they highlighted any ratios that had more or less than 10 percent difference. So if they were more in the regenerative, they are in bold. And if they were less in the regenerative, they are in italics. And I think on this, I'll just point out that across all farm pairings, regenerative farms had 34% more vitamin K, 15% more vitamin E, 20% more total phenolics, and then 22% more phytosterols. Um, so there is a role, in the soil, in the nutrient density. I'm just going to put a plug in if you're not aware or familiar with Dr. White in Rutgers University, his uh, work. He is doing work around plant nutrient content and specifically the microbes' role in that. Kind of fascinating work about how much microbes actually end up not just kind of what we think about them talking to, roots and presenting nutrients to plants, but actually end up with pieces of them kind of surrounding the DNA and influencing what is getting expressed in a plant, including nutrients and amino acid content and that kind of stuff. So I'll just leave this here for you to explore. Um, I'm going to also just talk to you a little bit about um, what it means to kind of have the access to food, I guess, or like fresh fruits and vegetables. And this was a Flint, Michigan study where they had almost 800 adults and they surveyed them about participation in a community garden and their dietary habits. And I saw that there are several people on this call that are, very integral in that in the state. Um, and In households where a member reported participation in a community garden, there was a statistically significant increase in the fruit and vegetable consumption in that house, which is good news. So, the other thing about that is that the odds of them consuming fruits and vegetables at least 5 times a day was 3.5 times higher. And this impressive sort of improvement actually did not play out when people were just presented with fruits and vegetables without a connection to the garden. So getting people connected to their food is like a really kind of boost, I guess, to getting them to consume what we would recommend as the, recommended serving. So kind of, we don't really use the food pyramid anymore to recommend that, but more this my plate. And so, that was encouraging them to get this half of their plate in a day. So, um, I'm going to switch gears a little bit and go to the environmental conditions that are related to soil as a determinant of health. And this, example here from this dust storm in Idaho is not, an isolated event. It's happened several times in different states across um, the US. I could definitely imagine it happening on I-80 during certain parts of the year. But, I don't want to be necessarily soil centric, but if you look at all of this soil in the air, it is certainly carrying things around with it that could be at risk, that would, obviously affect the surrounding communities. Um, and so if um, a farm practice looked more like cover cropping, as you can see in this picture, that is one solution to holding the soil where it's, at, and then holding water more efficiently as well. Um, this is another topic that I wanted to just talk about with related to water, and this is a composite map that was created as a result of the Nebraska Department of Environment and Energy nitrate drinking water study. This came about after a piece of legislation. It was LB 814 in 2023 was passed, and sampling was done of public drinking water systems and voluntary private well owners who agreed to participate, and ran from November of 2023 to March of 2024 with over 3,500 test kits that were returned. So if you look at this red, this is the above 10 milligrams per liter nitrate concentration, and that is the standard that was set. Um, so being above that is a risk for infants for having what is known as blue baby syndrome or methemoglobinemia, because nitrate levels above that can impair, especially in infants, their ability to actually carry appropriate amounts of oxygen. That standard is not set for exposures that might occur, in the womb, or might occur to adults who would drink something that was, be exposed to something above that over time. And so it's not set like for chronic effects, basically. Um, this literally, I mean, many of these slides could be their own presentation, and there's work, being done at the College of Public Health. I don't know if any of you are familiar with some of the studies around pediatric cancer rates in the state, but I think this is a very concerning finding in our state. As far as having nitrate levels that are just above, that standard that was set just for infants in the state. Um, I'm going to just briefly cover, I'm trying to be mindful of time here, that this is a enormous study that was published in 2024. And the aim of the study was to use population-based approach to consider the confounding variables of very county-specific rates of both smoking, these other socioeconomic vulnerabilities, so that social determinants of health, and practices on agricultural land. And the overall rationale of the study was that more pesticide use would lead to higher cancer incidence. And the reason that the authors kind of had that rationale is because there's no evidence that's been reported that pesticide use reduced cancer rates. And so they looked at cancer incidence, mortality, per county using NIH and CDC data, as well as information about smoking, which we know increases cancer risk. And then they had land use data from the USDA and census data around kind of habits of people to kind of separate out other risk factors. Um, the statistics around here are significant. This is a dense article to read, but they basically are laying kind of all of the other risks over top of pesticide use, and they were looking at 63 pesticides. And this is a unique study in that way because a lot of studies that you might look at are specifically targeting one. So they're taking one particular pesticide and looking at cancer incidence in a particular area. And so they then kind of decided what was their reference. And their reference, as you can see, are these white areas where the cancer incidence and pesticide use was low and estimated additional cases per year that would be attributed to differences in agricultural pesticide use patterns. And so the highest kind of category is this 154,000 additional cases per year as that dark, dark blue. Um, you can see that our state is concerningly dark, as is a lot of this Midwest region. And then they further looked at this with relationship to individual cancers. The article I encourage you if you're interested in this is to take a closer look at it because as you'll notice, like bladder cancer has kind of a different increased incidence in different parts of the country. Leukemia, lymphoma, and pancreatic cancer, a little bit similar pattern as far as like, and as well as the colon cancer. And they looked at this based on pesticide use patterns and have some of those connections in the article. But I think, this it definitely goes back to soil health and also kind of, what's in the soil and the water. So, um, this soil or social and community context is another area of social determinants of health. Isolation has not been shown to do anyone much mental health good or physical health good. And community gardening can be a form of civic participation. And there's research that children that are exposed to civic engagement are more likely to become civically engaged adults. The other thing about this is the kind of the term of social cohesion, or I like the term that was kind of defined in social science as collective efficacy. And this is the idea that people can join together around a shared belief and organize and execute courses of action required to produce something, an outcome that they want. And so I think it's really hard to have social cohesion when farmers and communities potentially maybe have looked at some of the data that I've just presented and feel like that might be out of alignment with the things that they value. Because I truly believe that farmers individually value the environment, but they have intense focus on, farm productivity, farm financial stresses around varying policy, increasing cost of inputs, and possibly social isolation, given some of the changes in rural, dynamics and population dynamics. And farmers are therefore, um, subject to mental health stressors as well, and happen to have and suicide rates that are 3.5 times higher than the general population. Um, so in this way, I think transitioning to practices that might support, holistic soil health, we can't task it to only the people that are farmers and producers. This has to be sort of that idea of collective efficacy, and in those communities with high collective efficacy, if you were studying this as a social scientist, those people have better self-rated health. They have lower rates of violence, and then they have better access to health-enhancing resources. Um, which kind of leads me to this last area that I was going to cover on social determinants of health, and it's sort of the idea of health access and quality. And I'm going to just highlight maternity care deserts, but if you mapped this out to access to primary care, which is what I provide, this is going to look very similar, a very similar map. We have an access issue to healthcare in our state, and in rural Nebraska, women travel about 30 miles to receive obstetric care, pre and postnatal care. Um, I think that this probably is correlated to this number. Um, we are down in another 100 farms since 2023. So from 2023 to 2024. And our average farm size is up to 993 acres. So I think, having enough people in a space to then have, access to primary care or maternity care is, we have to find some sort of balance there. Um, I'm gonna just really quickly highlight how much we spend in the US. We crossed $5 trillion in 2024, which ends up being around $16,000 per person. And 90% of that is on chronic health conditions or mental health. This is $200 more per person than we spent in 2023, and a large number of gross domestic product. So I will end on something that is like slightly more encouraging. And this is a study that was conducted in 13 to 15-year-olds, and they completed a question about soil health, and their interaction of soil with the environment and their perceptions of farming. I mean, a huge driver of my motivation for this is my own children, and so I don't think that we can leave behind like some succession planning here on including children in the planning, but for the children in the study who had a better impression of farming, they also had higher soil health literacy. Unfortunately, less than 35% of the kids in this study answered yes to the statement that soil is a living thing. But I do think that we have a lot of opportunity to potentially repeat this in a United States population or even in Nebraska, or incorporate this kind of education, not just, about gardening, but actually about soil. Um, so I think in there, so we have plenty of time for like some time for questions. I am very interested in coalition building within the state, particularly, along the lines of food as medicine, whether that is prescriptive eating or connecting patients with chronic disease, or in order to prevent chronic disease to, healthy opportunities. I'm going to stop sharing my slides. I know I didn't get through all.